cameras will be on throughout the presentation. I do not want people, when others are presenting, they leave the presentation. You had at least 3 months to know about this date. I do not want when you are presenting, somebody listening to you, and then when somebody starts presenting, you leave the room. That's very disrespectful and unprofessional, and we will not tolerate that. I've let it pass a couple of times, but I'm not going to let it pass today. If you leave when others are presenting, we're not going to let you into the classroom again. So that's one. Everybody knows how to turn on their audio and mute themselves. So the mute button is the
You're muted, Dr. Ramo.
sorry, yes. The next one is your video. And then the other one is the participants. And then you have a chat function. Just to recollect, all the groups will have one person running the slides. Is that correct? Okay. So that makes it easy for the group to go. You just need to say, next slide. Some people are very polite. They can say next slide, please. That's okay. The introductions are not going to be the pitch. The introductions are going to be your first name, your last name, Peer 360 Fellow, where you're joining from, city, state, and country. Country is important so that because we are not all based in the United States. Have fun, have fun. It's going to be exciting. Just relax. Presentations we're going to have, Brown, correct me if I'm wrong, we're going to have 20 minutes presentation, 15 minutes presentation, and then we're going to have 5 minutes of questions. But we have some wiggle room. If questions last longer, we're not going to stop questions just because we want to end the presentation. It shows that people are excited about your presentation. I hope you guys had some good rest. So Brown, if you can let people in, in the people who are in the waiting room, if you can let them in, we can start. Is my audio fine?
Yes.
Good. Dr. Susan, if you can relabel your Zoom space. First name, last name, comma, Peer 360, fellow or faculty. Any questions before we start? You guys have water, coffee, tea, legitimate drinks? All right, so Brown, any announcements you want me to start?
Yes, Dr. Rami, can go ahead and start.
All right. Good morning, good afternoon, good evening. My name is Dr. Ramulados Azuine. I am calling in from Washington, D.C., the capital of the United States of America. I am so pleased to welcome you this afternoon to Public Health 360 Fall 2024 graduation ceremony and capstone presentations. Today is November the 30th, 2024. This is one of the most exciting days in the history of our organization, in the history of the Public Health 360 program, where we are sending forth experts, skilled, experienced individuals who have passed through the crucible of learning over the last 3 months, rigorous training under the PA 360 program, and we are graduating them. We are welcoming them into the public health workforce because we know that regardless of where they come from, they are going out to do greater good. Our country, our world, our state need you more than any other time. There is a lot of misinformation. There is a lot of chronic diseases. There is a lot of gap in prevention. And so we're excited that you have successfully met the requirements for graduation to become Public Health 360 Fellows. You'll be joining hundreds of our alumni spread across the country to do good in the field of public health. Next slide. All right, this is what we're going to do today. I am going to give you my welcome and opening remarks. I am the lead faculty here at the Global Health and Education Projects. We are in the outskirts of Washington, D.C. After that, we're going to have an introduction of our Public Health 360 faculty and staff, all the faculty that are spread both in D.C. area as well as around the country. And then after that, we're going to have our Public Health 360 fellows introduce themselves fully, in full, right? This introduction is going to be our pitch in full. So in full, we're going to follow the last name in alphabetical order, and then we're going to go to the presentations, right? The first presentation today is for Group 1, Project CARE. Project CARE stands for Compassion, Acceptance, Resilience, and Empowerment in Benue State, North Central Nigeria. Group number 2 is going to present Connected but Cautious, Addressing Social Media Dangers Among Adolescents and Children in Northern California, Los Angeles County here in the United States of America. This is actually in direct response to a special report issued by the United States Surgeon General about the dangers of social media use among children and adolescents. The final group is going to be group number 3 is going to be presenting CLEAR Minds Nigeria, CLEAR Minds Nigeria, which stands for Community Literacy and Empowerment for Awareness and Resilience. This is a project that is also empowering for mental health in Nigeria. Then we're going to have closing remarks. After each of the presentations, we're going to open it up for questions, for chats, for interactions, for remarks before we move to the next group. Each of the groups will be given 20 minutes inclusive of question and answer. And they are doing this as a pitch session, pitching to funders so that they will see a lot of competition. And after that, we're going to have, our recession music, which is going to be really exciting. So on that note, I just want to say that this program is simultaneously broadcast on YouTube, on GHCP TV, on Facebook, and the recording is going to be there for our audience, for our alumni, and for our friends and our well-wishers from around the world. All right, so let's begin now with introduction of our faculty. And that's me, right? Rami Azuine. I am the lead faculty here, always excited to bring more people into public health. And we have done this now under my leadership, and I have an incredible team. My doctorate and my master's are all in public health here in the United States, and I have experience practicing public health across the world. Next staff. All right, Dr. Susan.
Thank you, Dr. Remy. I hope you can hear my voice. Am I loud and clear? Thank you. I'm Dr. Suzanne Ekejuba. I'm one of the faculties here at Global Health and Education Projects Incorporated on the PA 360 programs. I'm also the director of other programs that is managed by GHCP. My backgrounds are in veterinary medicine. I earned DVM from University of Nigeria. I also earned my PhD in pharmacology from Howard University here in the US, and a master's in data analytics from University of Maryland Global Campus, also here in the US. I'm calling in from Riverdale, Maryland, and I'm happy to have our fellows graduate today. This is one of the days that I smile and one of the days that I have to come on camera. If you haven't seen my face before, you have seen it now, because this is a day that I'm always happy to see you graduate in this program. Thank you. Back to you, Dr. Remy.
Thank you, Dr. Susan, for all your service. Next, we have Bram Magnus. You know, he does not need an introduction, but we can ask him to introduce himself. Bram, come on.
Sure, Dr. Romy. Thank you so much. So my name is Bram Magnus Olivers. I have a degree in computer science, and I work for GHEP as the outreach and IT coordinator. And this is one of the days I do enjoy what I see. I remember when you all started, we say, this is the day that you're going to look back and appreciate all the achievement that you've done. So thank you so much, and I look forward to see the presentation.
Yes. Next, I have Dr. Chidubem Eboluche. Chidubem.
Hello, everyone. Good afternoon from here. My name is Dr. Chidubem Eboluche. I'm a doctor of public health student at Morgan State University from administrative assistant. It's very nice to meet you all here.
Thank you. Thank you so much, Chidubem. We're waiting for Dr. Zubi to join, and once she's joined, she can actually introduce herself. Okay, now moving on to our fellows. Oh, Bram, thank you. You know, I was trying to crack my head to see who is the first one. All right, the first fellow to introduce herself will be Dr. Amna A. Clark. Amna.
Hello, my name is Dr. Amna Clark. I'm a medical doctor by profession, and I'm currently a Masters of Public Health student at the Johns Hopkins University. I'm also a Public Health 360 Fellow here at Global Health and Education's Project, which is a nonprofit organization working to promote health education and to eliminate disparities in public health. In this role, I'm working in a team of 3 public health scholars on a project to reduce mental health stigma among vulnerable populations in Nigeria, and I look forward to sharing it with you tonight. I would add that what drew me to public health was my passion to improve health-related behaviors in my community, and I look forward to telling you more about myself and our work as we proceed. Thank you.
Thank you so much, Dr. Clark. Profound gratitude, you know, joining 2 a.m. every day, every week from Pakistan. All right, next, Maria Juwanji. Maria.
Hi, everyone. My name is Maria Juwanji. I am a neuroscientist by profession, and I hold a Bachelor's of Science in Neuroscience from Temple University. Currently, I am also a Public Health Analyst Fellow at Global Health and Education Projects. GHEP's mission is to eliminate health disparities by addressing the social determinants of health. In this role, I work in a team of 3 fellows where we are developing or have developed a project addressing mental health stigma in Nigeria, as you will see soon. One thing that drew me to public health is my passion to create sustainable systems that enhance communities, especially in different underdeveloped communities worldwide. So I look forward to an opportunity to tell you more as we keep going. Thank you.
Thank you, Maria. I'm looking forward to really learning more about your project. Next, we have Aissata Dion Koroma. Aissata, take it away.
Hello, everyone. My name is Aissata Dion Koroma. I am a specialized health and nurse caregiver in surgical service by profession. I am currently pursuing a degree in health science at Charité Universität Medicine in Berlin. What drew me to public health is my passion for making a difference in the lives of those affected by health inequities. Currently, I'm a public health 360 fellow at the Global Health and Educational Project known as GHEP. GHEP is a non-profitable organization committed to eradicating health disparities by addressing the social determinants of health, commonly known as SDOH. At GHEP, I am working independently on the Clear for Young Minds project, which addresses mental health stigma in Kaduna, Northwest Nigeria. This project aims to reduce stigma, enhance mental health literacy, and improve access to mental health service through cultural sensitive and evidence-based intervention tailored to the local content. I look forward to telling you more about myself and the impact work of the Clear for Young Minds project.
Thank you, Aisara from Berlin, the capital of Germany. Next, we have Ellie Giayi. Ellie.
I'm a neuroscientist by profession, and I hold a Bachelor's of Science degree of Neuroscience from Emory University. Currently, I'm also a PH360 Fellow at a Global Health and Education Project, which is a nonprofit organization that works to promote community health and eliminate disparity in public health. In this role, I worked in a team of 3 on a capstone project to reduce mental health stigma among vulnerable population in Nigeria. In brief, I would say one of the things that drew me to public health is my passion to address health disparity at a global scale. I look forward to an opportunity to share you about myself and my project. Thank you.
Thank you so much, Ellie, for your work. Next, I have Hadasha Cortez. Hadasha.
Hi, hello. My name is Adasha Cortez Luciano. I'm a laboratory technician 6 by profession. I hold a master's in laboratory animal science from Eastern Virginia Medical School. Currently, I am a Public Health 360 Fellow at Global Health and Education Project. And as my fellow mentions, GHEP is a nonprofit organization that has as a mission to eliminate health disparities and by addressing the non-medical factors that influence health outcomes. In this role, I work in a group of 4 people trying to develop a community outreach program and capstone to address the dangers of social media for young people in the United States. In brief, I will say that one of the things that drew me to public health is my passion for helping animals and humans for a better society. And I look forward to an opportunity to tell you more about myself as we proceed. Thank you.
Thank you so much, Hadasha. Next, we have Merit Shawul. Merit.
Okay, hi, hello everyone. My name is Merit Shawul. I am a health scientist by profession. I hold a minor in psychology and a bachelor's in health sciences from Virginia Commonwealth University. I am currently a PH360 Fellow with Global Health and Education Projects, GHEP, which is a nonprofit organization with a mission to eliminate inequalities in health by addressing the social determinants. In this role, I work in a team of 4 people by doing research on how children and adolescents are affected by social media in the United States. In brief, I will say that one of the things that drew me to public health is my passion for achieving health equity and eliminating health disparities in vulnerable populations. I look forward to an opportunity to tell you more about myself as we proceed. Thank you.
Thank you so much, Merit. And next we have Landry Georges Yomkil. Georges.
Yes. Hello, everyone. I'm calling from Nicosia, Cyprus. Hello, everyone. I'm calling from Nicosia, Cyprus. I'm a healthcare manager by profession. I hold a master's degree in health management, and I'm a certified project manager professional. Currently, I'm a public health 360 fellow at Global Health Education Project. Global Health Education Project, Global Health and Education Project is a non-profit organization which mission is to reduce healthcare inequality and address the non-medical determinant of health. So I work in a team of 3 public health fellows where we work for addressing healthcare disparity and also addressing the danger of social media addressing the danger of social media for adolescents and teen in USA. What drew me to public health is my passion to reduce or increase the mental health well-being of underserved community. So I'm looking forward to tell you more about myself during this interview. Thank you.
Thank you so much, Georges. The last, but nevertheless not the least, Deborah Daniel. Debbie. Debbie, are you muted?
Hello, everyone. I'm sorry about that. Yeah, my name is Deborah Daniel. I am a nurse by profession. I hold a bachelor's degree from Western Governors University. Currently, I am a public health fellow with GHEP, which is a non-profit organization that focuses in health equity by eliminating the social determinants of health. In this role, I work with a team of 4 as a clinical director. In brief, I will say that one of the things that drew me to public health is my passion for health equity. I look forward to an opportunity to tell you more about myself as we proceed. Thank you.
Thank you so much, Debbie. If you listen to all the experiences, we have physician, we have nursing, we have health management, we have neuroscience, we have health science, we have business MBA people, we have psychologists, we have animal laboratory scientists. So you can see the diversity is one thing that brings all the PA 360 fellows in this cohort together. You can see that they come to this project, they come to this training program from different goals, but you can see one unifying goal is that each and every one of them is actually interested in eliminating health disparities. And again, it's important to understand that our organization, GHEP and PA 360 fellowship is purely, tailored towards helping and supporting individuals who are committed to addressing health inequalities wherever they find themselves. It could be in clinical nursing, it could be in medical practice, it could be in research, it could be in health science management, managing nursing homes, managing prison institutions, managing hospitals, or whether they are working in a laboratory. We want individuals to really understand what health inequalities are and who can go in their different roles to begin to address those health inequalities. So exciting. And I'm really looking forward to hearing the final capstone projects that each of our fellows are going to be providing. Before we move on to the next slide, I just want to make one comment that this program, what we're seeing today, is a culmination of 3 solid months of hard work. They can tell you behind the scenes is not, I'm really very nice, on the graduation day, but I'm not really nice behind the scenes. But you can see when they present today, when you hear the projects that they are going to be working on, you can see that they have all invested their time. They have invested their sweat. Some of them are joining the program early in the morning, midnight. Some of them are leaving job to join the program. Some of them are having to juggle family to join this. Some of them are having to leave little babies. But one unifying factor there, and this is what I pitch usually to employers of labor who approach me for references for our fellows, is that I said, look, if anybody could persist, invest the time to get this Public Health 360 Fellowship graduation, that person is the person you need in your team. So I'm really grateful for all the investment of time that you have all made in yourselves, in your careers, in your future. And I'm really excited for how you are going to become agents of transformation in your respective organizations. Next slide. All right, so this is us. I'm sure you have known us. You've seen me, Dr. Susan, Dr. Zubi. Nobody comes into the program except Dr. Zubi. Dr. Zubi is like the savior, right? It's like the Jesus Christ of the program. So you have to go through her to come into the program. Dr. Chidubem is there, our partnership director, and Brown, of course, is our tech. What can we do? We cannot do this program without these 4 individuals that you have seen here. I am the evangelist of the program, but without the support, the inspiration, and the work that they are doing behind the scenes, this program will not be successful. And I'm incredibly, grateful to all their work. Next slide. All right, this is our contact information. If you're a guest joining us, right? If you are in a different career, if you are in public health, if you are in medical practice, if you are in clinical nursing, if you are a graduate and you are wondering, what does it look like to be in the field of public health, PH 360 is for you. I hope you can look us up. I hope you can do some inquiries. We are so grateful and fortunate to be partnering with several universities in and outside the United States to support them in training the next generation of public health practitioners. And we're so grateful that our students graduate and they are transforming the world in different parts of the world. That's our contact information. Our website, globalhealthprojects.org, PH 360. We are very active on Facebook, MyGHEP. We are active on Twitter or X, MyGHEP. And we have a YouTube channel where you can watch all and the previous graduation ceremonies, GHEP television. Thank you, Brown. Next slide. All right. I am going to sit back now to enjoy myself, to listen to these transformative projects that is going to change the world in Nigeria, change the world in Los Angeles, United States. I am looking forward to it, Benue State, Kaduna State, and then, of course, the US. So are you guys ready? If you're ready, give me a thumbs up and say you are ready. If not, tell me whether you want us to call off the graduation ceremony. I need to see. Use your reaction button to tell me, yes, only one person is ready. Oh, Ellie says she's ready too. Maria, you ready? Okay, so I was thinking we should call it off. Oh, okay. You guys still want us to do it? Okay, all right. George, I don't think George is very convinced that we should move ahead. George, are you ready for the George said we should cancel. We're gonna cancel.
No, I'm ready.
You're ready? Oh, okay. I mean, I didn't see where you said we should go ahead. I said I didn't see, so we should just cancel it. Are we canceling? Oh, I'm gonna say okay. I said that you said we should go ahead. All right, so good. Okay, I thought you said we should just cancel it.
No, I had my thumb up like this. I think you didn't see it.
Okay, good. Okay, I thought you wanted us to have a Saturday and just enjoying that, and Debbie said we are ready. Okay, on that note, group number 1, Brown, give them, and this is gonna be exciting. Give them the virtual presentation floor.
All right. Hello, everybody. Good morning, good evening. Today I will be starting off our presentation on behalf of Group 1. My name is Maria Jiwanji. I'm a PH 360 fellow based out of Pennsylvania, United States. Harrisburg, Pennsylvania, United States. Okay, here we go. Our project today is called Project Self-Care. CARE stands for Compassion, Acceptance, Resilience, and Empowerment. This is our team, our core team. I am acting as the clinical director for this project. Like I said, my name is Maria Jiwanji. I have a Bachelor's of Science in Neuroscience, and I will let the rest of my team introduce themselves.
Hi, I'm Amna Clark. I'm a PH 360 fellow at GHAP, and today I'm joining in from Faisalabad, Pakistan, and I will be serving as the project director for Project Self-Care.
Hi, my name is Ali Jaihi. I'm the Monitoring, Evaluation, Accountability, and Learning Director for this project. I hold a BS from Emory University.
Okay, so our agenda today has many things. We're going to start off with the executive summary, followed by the introduction to the problem, followed by our problem statement, target population, goals and objectives, and then the bread and butter of our project, the self-care activities, as well as the timeline, who we are hiring, our entire staffing and personnel, the partnerships that we will be partnering with, as well as our budget, the outcomes of our program, the outcome evaluation, the process evaluation, and finally the dissemination plan. And at the end, we'll have a Q&A session. Before I get started into the executive summary, I did want to go over some key terms that will be used throughout the presentation. The first one being mental health literacy. It will be abbreviated as MHL throughout this presentation. Mental health literacy is the knowledge and skills that help people recognize, manage, and prevent mental health disorders. It also includes the ability to seek help when needed and reduce stigma around mental illness. And the second one is coping self-efficacy, which will be abbreviated as CSE throughout the presentation. Coping self-efficacy is the belief that one can effectively deal with stressful life events. It is a key self-evaluative variable that can impact a person's functioning in a number of ways. So that we have two key aims for our project. The first one being increase MHL among participants. And number two is to leverage the culturally familiar local workforce in Nigeria to address this sensitive issue. We will be recruiting and training community-based peers for educational and guided self-reflection activities, as well as collaborating with partners to design curriculum and materials for participants. And for data collection and assessing our outcomes, we'll be using a validated scale to collect coping CSE data at baseline and during sessions. And we'll be analyzing results to enhance MHL by raising awareness of self-stigma and boost CSE by teaching participants to counter self-stigmatizing thoughts with self-compassionate statements. So mental health stigma is a global issue with significant impacts in low-income countries like Nigeria. Self-stigma arises when individuals internalize negative societal views about mental health. Some key effects of self-stigma include shame, low self-esteem, and hesitation to seek help, and self-stigma deepens mental health challenges. According to a study by the WHO, 20 to 30% of Nigerians experience mental health issues. Yet, 80% of people with mental health needs are unable to obtain care, primarily due to stigmatization. A new study shows about 68% of people with mental illness in Benue State as having elevated internalized stigma. Moreover, 65% of the working age population of Makurdi live below the international poverty line of $2.15. So the exact location of our study will be based in Makurdi, Benue State. This specific place is the port and agricultural epicenter, and is also known as the food basket of the nation. Because of this, the role of its working population in building Nigeria's economy is indispensable. Makurdi serves as the state capital and has a total population of almost 500,000, with adults 19 or above comprising the majority of the population. I will now turn it over to Amna Ikhlaq.
Thank you, Maria. So in light of the statistics that we've just shared with you, our proposed target population for this project Self-Care are adults aged 19 or above who are living below the international poverty line of $2.15 in the Makurdi metropolitan area. Next slide. So here are our goals and objectives. Our primary goal is to reduce self-stigma, and our secondary goals focus on increasing mental health literacy and to increase coping self-efficacy, which will in turn increase health-seeking behaviors among the local population. So this is a bird's eye view of our work plan. As you can see, we've divided our plan into 4 phases. So the first phase will focus on curriculum development and establishing partnerships. Our stakeholders will help us in designing an educational curriculum to train the community peers who will then deliver these topics to community participants in a culturally sensitive context. Phase 2 involves recruiting and training the community peers who will be called ORSHA, and we will be talking more about that in a minute. And this training will be regarding mental health and self-stigma. Phase 3 involves recruitment of community participants who were part of our target population, and the ORSHA will then deliver our self-care activities to these participants. Lastly, we have phase 4, and phase 4 will focus on developing a report to communicate our findings with the local stakeholders and the public health community at large. So the major component of our project are the self-care activities. The first component includes an educational campaign, which will be administered to the community by the ORSHA. ORSHA is the term used in Tiv culture, who are the predominant ethnic group residing in the Makurdi region, to refer to a peer or a guide. In the same vein, the sessions conducted by the ORSHA will be termed as quasi-ORSHA or guided learning. So who will be these ORSHA? They will be community-oriented health workers recruited from the Makurdi metropolitan area because they are best suited to deliver culturally sensitive messages. The educational aspect will involve raising awareness about mental health stigma, its types, and how self-stigma in particular can impact help-seeking behaviors. We also aim to equip participants with skills to reframe self-stigmatizing thoughts into positive, supportive statements oriented towards fostering compassion and acceptance for the self, hence self-care. Our second component of phase 3 is intended towards measuring coping self-efficacy using the coping self-efficacy scale, which is a measure of perceived self-efficacy for coping with challenges and stresses such as self-stigmatizing thoughts. This will involve monthly check-ins after the initial educational session or quasi-ORSHA has been delivered. During these subsequent check-in sessions, the participants will fill out the scale again, and the ORSHA will reinforce the educational and skill-based messages from earlier sessions according to this new score, and they will be available to address any concerns that the participants may have. This is intended to build self-resilience and empower the participants to improve their overall mental well-being. So this scan chart shows a snapshot of our proposed one-year timeline for Project Self-Care. Phase 1 will proceed over the first 3 months, and it will involve designing a curriculum and stakeholder meetings as discussed above. Phase 2 will be broken down into 1 month for recruitment of the ORSHA or community peers, and then a subsequent month of virtual training sessions for the ORSHA. Phase 3 will be similarly structured as Phase 2, with the first month focusing on recruiting participants from our target population, and the subsequent months will be focused on delivering the self-care activities to the participants. The last 4 months of our one-year timeline will constitute Phase 4, where we will be focusing on developing a detailed report to publish our findings. Next, I want to share with you an overview of our project's organizational structure. So the leading partners, as we have proposed, shall be Global Health and Education Projects and the Benue State University, whose research on internalized stigma informed this project. I shall be serving as the project director, with Maria Jivanji as clinical director and Ellie He as the meal director. We are also looking to hire a communications and outreach officer to support us in this process, as well as a research analyst to support us in Phase 4 of our work plan. According to our calculations, we require a statistical sample size of around 150 participants from our target population to achieve valid findings and make evidence-based recommendations to address self-stigma. Therefore, we've proposed recruiting 10 ORSHA or community peers who will each be assigned 15 participants, and you will see this reflected in our budget. I'm now going to hand over to Ellie He to share the nitty-gritty details with you.
To go into the details, we have well-trained and qualified leaders for this project. Dr. Amna Ikhla has a bachelor's in medicine as well as surgery, and she is now an MPH candidate. Her role is to define project objectives, goals, deadlines, and establish timelines. She also helps to build and oversees the budget and allocates resources efficiently. She helps to develop and maintain positive relationships with stakeholders and team members. We have clinical director as Maria Jivanji. She holds a Bachelor's of Science in Neuroscience and Project Management, and her role will be to develop curriculum for public awareness campaigns and peer training videos. She supervises peer trainings and ensures ethical principles that are allowed and content is culturally relevant. And lastly, I will serve as the Monitoring, Evaluation, Accountability, and Learning MEAL Director, and I have a Bachelor's of Science in Neuroscience and Behavioral Biology. My role in this program will be to coordinate and deliver training for meal and program staffs. I will also ensure data quality through regular audits, spot checks, and validation processes. I will also foster collaboration, transparent, and accountable relationships with my collaboration partners. And next, we will be hiring a few people to help us to execute this project. We will hire one community outreach officer to engage with community members and stakeholders to promote the project, facilitate the participation, and build lasting partnerships. We will have one mental health research analyst to collect, analyze, and interpret data to assess the impact of education campaign and inform program improvements. And we will hire a few OSHAR translated to peer in TIFF to conduct quasi-OSHAR sessions to improve mental health literacy and coping self-efficiency among participants. They will also engage community members in culturally sensitive peer education and stigma reduction activities to foster resilience and empowerment. We will have 3 organizations that we will have partnerships with. The first one will be Benway State University, and our collaboration will focus on they offering us the academic expertise and research support. We will receive helps from them about curriculum development, training resources, research and evaluation, as well as recruitment support. We will also have tightly collaboration with Marcudi government and health authorities for the administrative and logistical support. They will help us with the permits and approval, community mobilization, integration with exceeding services, and monitoring and sustainability. Lastly, we will have cooperation with Aceto Foundation, which is a nonprofit mental health organization, and we will collaborate with them for the mental health advocacy and digital outreach. We will integrate with their Herald program with OSHAR peer educators, and we'll have online collaboration and resource sharing to expand digital reach and foster mentorship and continuous support, as well as supporting for our community advocacy. Our total budget for this project is $120,000, and the indirect cost will be 10% of it, which will be $12,000 USD, and the direct cost will be the rest. This is the breakdown for our budget. So for the direct cost, we will be spending $108,000 USD on this, and roughly half of them will go to the direct salary cost of our people in the leadership, and we will have $20,000 spent on OSHA workshops and materials, and that will be broken down into curriculum development, OSHA training materials, OSHA recruitment campaign, and virtual meeting costs. And another $22,000 will be spent on participant recruitment and quasi-OSHA. So $5,000 will be spent on curriculum development, $6,000 on recruitment campaign, and $10,000 on literacy materials. For the rest, $10,000 will be spent on monitoring and evaluation. This includes data collection tools, pre and post services, surveys, and data analysis and reporting. We will spend $7,000 on administrative costs, which includes local permits and approvals, space and rent, and office supplies. Lastly, for the partnership and stakeholders, we will be spending $5,000 on program materials and virtual meetings. Lastly, in total, there will be $12,000 spent as the indirect cost for this program. We have broken down our program outcomes to 3 parts in terms of the duration. For our short-term goals, we want to increase the percentage of participants who correctly identify self-stigmatizing thoughts to at least 30% compared to the initial baseline measurements. We also want to reduce overall prevalence of self-stigma from 69.7% to at least 30%. For our medium-term goal, we want to enhance mental health literacy through targeted, culturally sensitive messages, and we aim to improve CSE skills to make individuals' default decision healthily. In terms of our long-term goal, we want to reverse socioeconomic factors such as poverty and unemployment that contribute to the mental health stigmatizing thoughts. And we will also aim to improve the chances of these adults to reach their full potential and secure better pays and education levels. And for our outcome evaluation, the primary outcome is to reduce stigma, and this will be measured by comparing pre and post program scores on the CSE scale. For our secondary outcomes, we want to increase MHL by assessing the participants' ability to discuss and share mental health knowledge in their communities. And we also want them to increase in coping self-advocacy by tracking participants' willingness to make healthy decisions and seek professional help for mental health issues. For our long-term impacts, we will measure by evaluating sustained reductions in self-stigma over a 6-month follow-up period. We will evaluate the process by productivity, effort, and quality. For productivity, we will measure it by the number of workshops of sessions delivered, as well as numbers of participants engaged in the workshops and sessions. For the efforts, we will evaluate the time invested by staff and volunteers to deliver program activities. We will also do it through the assessment of resource allocation and program scalability. For the quality of efforts, we will collect feedback from participants and community partners on the relevance and quality of intervention. Lastly, I will talk about our dissemination plan. The objective is to address self-stigma and improve mental health in Makuri, Nigeria. The strategies will be through detailed project report summarizing outcomes, share quantitative findings on self-stigma reduction and coping self-advocacy improvements, and presentation of qualitative insights on change in attitudes and behaviors. Our audience will be stakeholders, local partners, and policymakers. The impact will be to showcase the effectiveness of cultural sensitive interventions and to highlight the potential for long-term socioeconomic stability in the community.
So thank
And
you,
that's it.
everyone. Yeah. So thank you,
I will
everyone.
pass it to Mario.
Oh, it's okay. I can take over. So thank you everyone for joining us for our session on Project Self-Care, and we will now open the floor to any questions that you may have.
Very good. Thank you so much, Group 1. That was well done. I have a lot of questions here, but first, before we jump to the questions, can you use your reaction button and let us give Group 1 a round of applause? Reaction button. Let's see what I'm gonna give them. That's my, yes. So if you go to your reaction button, okay. Hands of applause. Very, very good. So we're gonna go directly to the question. Brown, let me know when we are exceeding time. So the first question I have here says good presentation. And then they were asking you say you vaguely talked about an outcome of this project being change in health-seeking behavior. Can you speak a little bit more about that? Right? The person is saying that they think that should have been a key outcome of the project, because how would you know whether somebody has how would you know whether somebody has reduced self-stigma, whether somebody feels better if they do not seek help? And so missing that is I think is a big gap in this project. So can you address that? How do you really specifically measure what works in this project?
Yes, I can take that question. So basically, the thing is that this project itself is based on a recommendation made in a study done by Benway State scholars, which which was focused on just showing quantifying the prevalence in the community. So this is a very complex situation and a topic, and the thing is we do want to do everything all at once, but that's not always possible given our budget restrictions and the resources we have, and everything may involve a step-by-step process. So they provided us with the data to be able to design this project to address the behavior change in the community. So because they recognize that there is the need or the gap that this behavior exists and it needs to be changed. So our project at the moment is particularly focused on in taking action to change those behaviors. And as we stated in our evaluation process, that we do want to have a 6-month follow-up period. And that is when we would be focusing on addressing and evaluating that are people actually seeking help for their stigmatizing thoughts. Because if our first hope is that the number of participants who are experiencing self-stigmatizing thoughts is going down, so automatically the number of people who would be needing to seek help would go down as well. But in the case of those people who would still need to seek help, because our peers are community-oriented health workers, so they are already some of the people who are intended to provide this help for people who are looking for it. And they will also be there to provide referrals to people who need further resources. And secondly, we do have a component of, because more of our findings are presented in our grant proposal document. So we do actually have a component saying that we will have provided both printed and digital resources to our participants in terms of who has a different educational level, difference in literacy, and difference in accessing, because this is an LMIC setting. So we want them to be able to, whatever their preferred medium of learning is and medium of seeking support, we will make sure that the ORSHA can deliver it to them.
Thank you. So the other question is, we're going to take the question by Asada, but the other question is, can this program be implemented in East Africa?
I can speak this question.
Or maybe what would it take to implement this program in a different African country?
Yeah, so theoretically, it would be kind of dumbing down which populations in East Africa are more susceptible to mental health and self-stigmatizing behaviors like we've done for Benue State. I believe that the idea of the program can be honestly implemented anywhere. The key point is to identify the key population. And it would look pretty similar in the sense that the structure would be similar. Obviously their government and their rules and their restrictions obviously apply to each country. So in that way it would be different. But the general structure of the program, we aim to keep the same if implemented elsewhere.
Thank you. So we have a question here. How do you plan to reduce socioeconomic disparities and unemployment? I guess regarding the population of interest.
Yes, so those are our long-term goals. I'm not sure if I can share my screen. Let me see. Can you see my screen?
Yes.
Yes.
Ah, yeah. I just need to move this. So this is our document, and in this, on page number 8, we have the health impact pyramid. So just one more time, can you, I'm sorry, repeat the question?
Says, how do you plan to reduce socioeconomic disparities and unemployment?
Yeah, okay. So what I was trying to say is this is the health impact pyramid, which is a commonly used framework for public health action. And it's the interventions that are shown at the top, they require more individual effort. And those at the bottom are the ones that would require more effort on behalf of like public actors or private actors as well. So our project self-care is focused on is designed in a way that the effect should flow down from the top to the bottom. So if you take a look over here, the very first tier is counseling and education. So we are self-care activities, they are focused on this particular tier, and they sort of feed into the, it's not a clinical intervention, but it is an intervention in a sort, because we are taking active action to change behaviors in the community. So this feeds into creating more long-lasting and protective interventions, which will change the context. So our basic as we already cited in our presentation as well, the goal here is to change the context that the individuals, they will make default decisions. So as a result of the education and the skills that we are providing to them, they are going to be able to change the context of their mental health disorder. They are going to be able to change the way that they react to the mental health disorder and the self-stigmatizing thoughts. And when there is an improvement in that, it leads to an improvement in socioeconomic factors. So poverty itself, it can both be a consequence of mental health stigma, but when once you are experiencing unemployment or poverty, the thing is that it will feed into increasing your distress regarding your mental health state. But if you overcome your stigma, that in turn will enable you to be able to lead a more productive life and able to be catch opportunities where you can participate in better opportunities and more learning opportunities, and you can achieve, you reach your full potential, and you can be able to, I'm sorry, I couldn't see you guys. Yeah, you can just find opportunities where you are able to earn more and you are able to apply your skills, and that will in turn improve your socioeconomic status and in turn improve your mental well-being. So it's sort of all just interlinked.
Thank you. We're going to take one more question and then move on to the next group. And please try to keep your response short and sweet, right? So someone just put in here, say, what are the key bottlenecks to the successful execution of the project, particularly with regards to cultural beliefs and government policies in the region? So what are some of the challenges that you're anticipating experiencing in the implementation of this program?
I can talk on this. So I think firstly, and the most prevalent one is people identifying the self-stigma, identifying the mental health within themselves, within, if they're willing to identify these mental health issues within themselves, that's the only way that they'll be able to take action. That's probably the biggest one. It's more of like, for example, in many cultures, mental health is very taboo. It's not talked about enough. And that in turn leads to many, a lot of holding back and not being able to seek the help that people need. that's in regard for cultural beliefs, but for government policies, I mean, you could see a whole bunch of backlash from the government just because, mental health isn't as funded, as brought up to the forefront of public health as it should be. We try to say that mental health is first before physical health. So I think a lot of the pushback from the government in regards to that would be also an issue. Yeah.
Good question, good response. Once again, let's give group one hands of applause. Really good, really good. All right, so we're gonna move on to group number two. And the same way, if you are very shy, you can send the questions to me. Otherwise, feel free to use the chat for questions. Group two is gonna have inclusive of 20 minutes. Brown is gonna give you warning when you are 5 minutes, just to make sure that you are not exceeding your time. Okay, group number two.
Okay, let's go. So I'll be sharing my screen.
Hello, everyone. My name is Deborah Daniel, a Public Health 360 Fellow. I am the clinical director of this project, and our project is Connected but Cautious. We're addressing the social media dangers among adolescents and children in Northern California, Los Angeles County in the USA. With me are other team members who will introduce themselves. I'm calling from Texas.
Hello, everyone. My name is George Ramkiel. I'm calling from Nicosia, Cyprus, and I'm the project director of this initiative. And also,
My name is Hadasha Cortez Luciano. I'm a Public Health 360 Fellow. I'm currently the Director of Monitoring and Evaluation, and I am joining from Baltimore, Maryland, United States.
Hi, everyone. My name is Merritt Shaul. I am a PH360 Fellow. I am the Director of Outreach and Communication, and I am calling in from Alexandria, Virginia, in the United States.
Before we dive into the details of this presentation, I'd like to walk you through the key points we'll be covering today. This will give you a clear roadmap of our discussion and ensure we are all aligned. To summarize, we'll start with the problem statement, outline the objectives and purpose. Then we'll dive into the specifics, covering the directionality, methodology, implementation plan, health impact pyramid, the theory of change, and outcomes. Following that, we'll look at our evaluation plan, our risk management plan, staffing, budget, and conclusion before closing with our partnerships and next steps. With the agenda set, let's get started with the first topic, our problem statement. Social media use among adolescents and children has increased significantly, with 54% of teens experiencing online harassment. Cyberbullying, online predators, and social media addiction pose serious health threats to mental health, well-being, and safety. To address these challenges, our program is focused on 5 key objectives, which include increase awareness, promote behavioral change, improve digital literacy, enhance access to resources, and sustain the program. In our first objective, our goal is to educate at least 1,500 participants, which include 1,000 adolescents and 500 parents and educators, about the risk of social media and essentially safety practices within the next 24 months. In our second objective, we aim to reduce self-reported cyberbullying incidents by 30% among program participants by the program's conclusion. Our third objective, improve digital literacy. Our objective is to deliver 20 school-based workshops annually, reaching at least 500 students per year, focusing on online safety and mental health. With our fourth objective, we plan to establish partnerships with 5 local organizations to provide continuous mental health support and online safety resources to underserved communities. And finally, with a sustain the program objective, we will develop a framework to ensure the continuation of the program beyond the grant period by leveraging partnerships and securing additional funding. With these objectives in place, it's clear that our approach is comprehensive and focused on tangible outcomes. But beyond the specific goals, the overall purpose of this project is to educate and empower key groups, which are adolescent parents and educators, so they can navigate social media responsibly and safely. And additionally, we aim to foster awareness, build practical skills, and create a more informed, resilient community ready to tackle the challenges of the digital age. Now I will hand it over to Deborah.
Thank you, Adesha. Connected but Cautious aims at mitigating the negative impacts of social media on the mental health of adolescents and children in Los Angeles by empowering the stakeholders with tools, knowledge, and resources. Next slide, please. The methodology and implementation plan. This project will be carried out in 5 phases: the research and needs assessment, educational material development, awareness campaigns, prevention and intervention programs, and then we will evaluate and see the possible sustainability planning. It's a project that we plan to implement within 24 months. On the research and needs assessment, we shall conduct surveys on focus groups with adolescents and parents. We shall create toolkits for schools, parents, and community groups, develop digital literacy guides and mental health resources. We shall create awareness campaigns and outreach. And under prevention and intervention programs, we hope to implement pilot programs in selected schools and train facilitators and peer mentoring. Then we finally go into the evaluation phase. Next slide. Now we are going to take a look at the health impact pyramid of these dangers of social media, starting from the socio-economic factor, which is the base. Addressing socio-economic factors is pivotal in mitigating the dangers of social media. We shall look at changing the context to make the individual's decisions healthier. We shall focus on creating awareness where the teens will make right decisions when using social media. And then we look at the long-lasting protective interventions of the use of social media. There shall also be clinical interventions to those who have already been affected by social media abuses like cyberbullying, just an example. And then there shall be counseling and education. The more this awareness is created, there will be increase in individual effort to use social media in the proper way. Next slide, please. We talk about the theory of change. We'll look at the problems, the inputs, activities, outputs, short-term outcomes, and the long-term impact. Under the problem, social media use negatively affects self-esteem, mental health, and safety. In the inputs, we talk about fundings, hiring expert staffs, partnering, and then we talk about community resources. Under activities, we shall educate community members on safe online practices and provide interventions. We also hope to increase awareness of social media risk. Educational resources distributed to target population, and we shall also implement prevention and intervention programs. As our short-term outcomes, we hope to improve digital literacy among adolescents and also reduce online harassment and cyberbullying. And as a long-term impact, we hope to reap out safer online environments for children and adolescents and enhance mental health and well-being. At this point, I hand over to my partner team member, Merit.
So the logic model is utilized for this initiative as it effectively maps the pathway from resources to impact by linking specific actions to desired outcomes. There are 3 reasons why it is effective. Starting with our clear alignment, it links resources, activities, and measurable outcomes, ensuring that all efforts directly address the issue of social media's impact on mental health. For our outcome-oriented, it focuses on achieving tangible short-term effects such as reduced cyberbullying and long-term impacts such as improved mental health. It engages stakeholders by promoting collaboration by clearly outlining goals and progress. This structure and adaptable approach ensures efficient and targeted interventions of connected but cautious initiative. Next slide. So our outcomes. Starting with short-term outcomes, 70% of program participants will report increased knowledge of online safety, and it will reduce prevalence of cyberbullying in target communities by 30%. For our medium-term outcomes, this enhances digital literacy for 10,000 adolescents and parents, and it increases engagement in mental health support services. And then finally, for our long-term outcomes, it's sustainable community-led efforts into online safety, and it's also significant to be able to improve mental well-being of program participants. Our evaluation plan. Starting with our tools and techniques, we will have pre- and post-program surveys to measure knowledge and behavior changes, and we will have focus groups with participants and stakeholders for qualitative insights. With data collection, we will have metrics on cyberbullying reports and online harassment cases, and social media engagement and feedback from educational materials. We have 3 levels of evaluation levels. Starting with our outcome evaluation, we will measure program impact on mental health and online behavior. For our productivity evaluation, we will assess the efficiency of program activities. And for our capacity evaluation, we will be able to evaluate the community's readiness to sustain efforts. And then for our dissemination plan, we will start with the public outreach, where we will publish educational content on program websites and social media, and we will host webinars and community events. Policy engagement is where we will share the program findings and recommendations through policy briefs, and we will be advocates for enhancing online safety legislation. With stakeholder engagement, we will provide regular updates and reports for funding organizations, and we will also collaborate with schools, community leaders, and partner organizations. I will now hand it over to my colleague, Georges.
So in order to achieve the project within the timeline, the budget, and the scope, it's very important to identify risk early on. So we have identified 3 main risks on this project. So the first risk is the stakeholder engagement. So stakeholder engagement will pose a resistance to acknowledge social media as a risk. So the impact it will have on the project is that it will reduce the buy-in from key stakeholders such as parents, educators, and community leaders. So how we're gonna resolve this issue is to present data and testimonial highlighting real-life consequences of unsafe social media use. Then the second risk is also the community participation risk. As public health professionals, we have to address healthcare equity. So what we have to do here is to partner with trusted local organizations to foster relationship and credibility in order to have participation from underserved community. And thirdly, financial risk. The lack of funding for long-term initiative can disrupt or have a very negative impact on the project. So we hope to develop a sustainability plan by incorporating partnership with school, non-profit organization, and private organization. Then for the staffing plan, the key member of our team are composed of the clinical director, which is Deborah Daniel. Deborah Daniel will provide guidance on and oversee mental health component and the clinical aspect of our program. Then the project director, which is me, I will manage the overall program direction, operation, and stakeholder coordination. Then we have the director of monitoring and evaluation, Adasha Cortez Luciano, who will be working on the development and implementation of evaluation framework. Then we have the director of outreach and communication, Mary Chawel, working on the campaign side, the awareness side, and the community engagement side. Then the key role and responsibility and task of our team are leadership, coordination for the program activity, data collection, reporting, and stakeholder communication. Then we also have the execution of workshop, campaign, and different intervention. So the budget that we have is $120,000 and have two main components. We have our direct cost and indirect cost. So the direct cost is 90% of our overall budget, and the indirect cost is 10%. So in the direct cost, we have more of our spending will go on the personnel, the research and material, the awareness campaign, the prevention program, the evaluation of sustainability, also travel and miscellaneous. So for the indirect costs, we have mostly rent, utilities, office supply, and other equipment. And in conclusion, the initiative Connected but Cautious is a program that addresses a critical health issue by creating safer digital space for adolescents and children. So with evidence-based strategies, strong partnership, and a focus on sustainability, we aim to reduce the negative impact of social media on teenagers and adolescents. So also, the funding of $120,000 will enable us to have impactful action on our community. So together, we hope to build a safer, healthier environment for our future generation. Then also, we have planned partnership with different organizations that we share the same mission. We have planned partnership with school and educational institutions such as public, private, middle and high school, mental health organizations such as National Alliance of Mental Illness, International Institute of Digital Media and Child Development, also technology companies such as Meta and TikTok. Also, we have planned partnership with faith-based organizations like California Community of Church. So we hope to develop partnership with organizations that we share the same mission, vision, in order to have a overall positive impact on the mental health on their community, like adolescents and children. So thank you for listening to our project and initiative. So we are very happy to reply to any question you have.
Very good, very good. That was good. So please, let's use the reaction button and give group 2 our reactions. Nice one, nice one. Okay, and the questions are pouring in. Okay, I have, yeah, these are good questions. Okay, the first question is, why did you choose Los Angeles in the United States? Why LA? How did you arrive at that decision?
I can take this question. There was a study performed by CloudWords. It's like a online security platform. And they found out that one of the states with many social media dangers is California. And then I personally search which actual location is the one that have issues, and it turned out to be Los Angeles County, and it's mainly because of the high population that they have.
So we can also add that the high incidence rate of cyberbullying around teenagers in California, mostly Los Angeles, have also been an indicator that where we have to look at in order to implement our program and have a greater impact on the community.
That's interesting. Thank you. Then the other question was, I don't think, do you have data on which social media platform that your target audience uses the most? Do you have that, or is that something you got to check in? Yes,
We'll
Debbie.
check in for that one.
Yeah,
Debbie.
Based on the age range of the age range of the teens we're using, they use TikTok the most. Google says TikTok comes first and followed by Facebook and Instagram.
That's interesting. I thought that all young people have run away from Facebook. So that data is saying the opposite, which is interesting. Okay. So TikTok then, okay. How will you know that your project is successful?
So we hope to achieve an improvement of the mental health and on teenagers and children. So we have key metrics, like we have done an assessment need in order to know the community need, and also after implementing the program, after doing workshop, after educating the parents, we plan to have feedback from the participant. So feedback are very interactive in the way that it helps us to understand if the program or the activity we have been implementing actually have impacted the targeted population. So feedback is very important, and also we should monitor the data in order to see what we can do to improve continuously.
There is a question there. Dr. Susan said a large percentage of cyberbullying victims pursue suicide. What are your immediate advice, or what do you suggest to caregivers and parents who are caught up in this?
I can answer the first part. Well, as a parent or as a caregiver, we encourage that when it comes to adolescents and children, you should monitor their social media activities to prevent any cyberbullying from progressing. And when we say monitoring like their activity, we mean like, for an example, making sure by a certain let's say when it's like bedtime, like you make sure like they put their phones away, they put everything away. And then once you're able to give them that independency, like of being able to monitor their own activity, you should still like have those discussions with your child and be like how are you doing? Like just check in with them until you're confident enough that they can handle like the social media.
Debbie, anything to add?
So
yes, sir. Oh, okay.
Yes. Just allow Debbie to, yeah.
During our outreach programs, we hope to teach parents and community members on the use of suicide assessment tool, SIWA. So from time to time, we will encourage parents and community members to use this tool to assess their children for thoughts of suicide, which include a child being isolated and cutting off, not associating, not speaking out. And then we will also, during the outreach, give them numbers to the suicide prevention line to call at any time.
So also, just to add, building a safer environment, open environment where communication is very important in order to identify early sign of suicide. Also, during our program, we have developed awareness program focusing like some exercise that can be helpful to distress, like head breathing exercise that will help adolescents and teenagers, adolescents and children to manage their mental health state, to reduce their stress, to reduce their anxiety, and to feel more confident about themselves to deal with difficult situations. So it's all about communication. The parent have to monitor, it have to be open because the child have to come across and explain the situation where he or she feels safe and understood. So that's also part of our program to support in different areas. So yeah.
Very good. Any other questions? All right. Thank you so much for group number 2. Let us show them some love with the reaction button. Let's show them some love. Nice work. Nice work. Great demonstration of case study knowledge. Thank you so much, Dr. Kayode, for that comment. All right, now we are handing over to the last group, the last individual, actually, but not the least. Aissata Dion Koroma. Aissata, the floor is yours.
Can you see my slides?
Yes.
Okay, good.
But you need to put the slide on slideshow.
Yeah, I know. I'm going there. I'm going there. So you can see my slides now.
Perfect.
Okay. Hello, everyone. My name is Aissata Dione Koroma. I am thrilled to be here as a Public Health 360 Fellow. I'm tuning in all the way from the vibrant city of Berlin, Germany. Today, I'll be presenting the session from the beginning to the end, and I'm excited to share this journey with you. Clear Minds stand for community literacy and empowerment, for awareness and resilience for young minds. This project focuses on addressing Nigeria's mental health crisis, particularly for youth in Nigeria and Kaduna. Kaduna is situated in the northwest region of Nigeria, is renowned for its cultural diversity and historical significance. Despite its economic and social contributions to the nation, the state grapples with significant mental health challenges, limited access to mental health service, deeply rooted stigma, and underserved youth population exacerbates these issues. These challenges position Kaduna as a priority region for targeted intervention, aimed to reduce stigma, improve awareness, and increase the access to mental health support, particularly for the youth. So here is what we will cover today: an introduction to Nigeria's mental health crisis, focusing on the Northwest region, the goals and objectives of the Clear for Young Minds project, our methodology and theory of change, the high-level overview of our project timeline, and the staffing plan, including my role and the team composition, evaluation method, tools, and anticipated outcomes, conclusion, and the next step. So I am Aissata D. Koroma, a registered nurse specialized in operating theater care, currently pursuing a health science degree at Charité University Medicine in Berlin. I've already finished the program, but I'm still writing my thesis, so much to that. Here are key abbreviations. Throughout the presentation, I will use a few key terms which are listed in the slide. These acronyms help streamline the communications of my concept. The major ones here are mental health and, of course, the acronym for community literacy and empowerment for awareness and resilience. So now the executive summary. The Care for Young Minds project aims to reduce mental health stigma and improve access to resources for youth in Kaduna, aligned with WHO Mental Health Action Plan from 2013 to 30. Combine the Mind Connect app with community workshops at Ahmadu Bello University and Berewa College and local centers to offer tools, resources, and access to mental health providers. Collaborate with local organizations and faith-based groups to leverage community networks for maximum impact. Operate with a budget of $120,000 to access progress in awareness, stigma reduction, service uptake, creating sustainable mental health solution for Kaduna youths. Introduction to Nigeria mental health crisis. The mental health challenges are widespread in Nigeria, affecting 20 to 30% of the population, about 40 million people with internalized displaced persons, and the COVID-19 pandemic further exacerbates this crisis. 9% of the individuals with mental health conditions receive any forms of treatment, while only 1% specialized care. Among the IDPs, 60% exhibits probably depression and 60% experience severe depression, highlighting their vulnerability. 96.5% of the Nigerian passive individuals with mental illness as dangerous and untrustworthy, intensifying stigma and social isolation. A severe shortage of professionals persists, with only 200 psychiatrists and 1,000 psychiatry nurses served over 200 million people, which is, these statistics are very old because to the recent statistics I saw, it's about 230 million people in Nigeria, just for correction purposes. Mental health funding is insufficient, accounting for just 3 to 4% of the national health budget, way below the 10% recommended by WHO. The COVID-19 pandemic increases global anxiety and depression rates by 25%, with Nigeria seeing worsening mental health outcomes, especially for the youth. Suicide rates are alarming, with Nigeria recording Africa's highest suicide rate at 3.5, and impacting the youth age from 15 to 29 years. In the Northwest region, these challenges are even more severe, particularly for youths and underserved population. Necessity, urgent, and culturally tailored interventions are here needed. So the key problem statement, Northwest Nigeria. The prevalences of mental health issues affect 20% of Nigeria annually, with 35% among youth, but only 10% of those affected receive care and just 1% access specialized treatment. Sources of professionals, 85.3% of the people report that lack of trained mental health workers create a major barrier, while 73.9% highlight cultural beliefs and stigma as obstacle to accessing service. Limited awareness, only 30% of Nigeria have a basic understanding of mental health, and 85% youth underserved regions lack information about available mental health support systems. This is very bad. Cultural barriers are also evident. 52% of the population believe mental health is caused by supernatural factors, and 50% rural areas respondents hold negative attitude towards mental health, though individuals with literacy levels are shown to improve perceptions. Policy changes. The Nigeria Mental Health Act from 2021 is underfunded and poorly enforced, while limited awareness campaigns perpetuate stigma and misinformation about mental health. The youth mortality conditions are linked to 23% of youth deaths, causing significant losses in productivity with a 43% reduction in workforce output. Suicide rate, the Northwest experiences one of Nigeria's highest rates, with 3.5 of the deaths in the region attributed to untreated mental health conditions. These statistics highlight the critical need for tailored mental health intervention and broader community-based solutions to reduce stigma, improve literacy, and expand access to care in the Nigerian region. The goals and objectives for the Clear for Young Minds project. Our project aims to aim overall goal to reduce mental health stigma and improve the mental health outcomes for youth in Nigeria by aligning with the WHO Mental Health Action Plan for 2013 to 30. Improve awareness, which means educates youth in underserved areas on mental health risk and reduce stigma from 96.5% to 75%. Reduce stigma, implement educational initiatives in collaborations with one school and one university in Kaduna, enhance service uptake, increase mental health service usage by 20% in targeted regions, and encourage proactive help-seeking behaviors. This is very important. So the methodology and implementation plan. To achieve the project goal, we will implement the PDA framework and pick out definition. The problem, high mental health stigma and low literacy among Kaduna youth. The approach, we will use a dual strategy combining digital tools through the Mind Connect app on Android and iOS platform and community-based intervention, including workshops at Ahmadu Bello University and Beleva College in Zaria. The Mind Connect app will features offline accessibility to ensure broader usability in underserved areas and include self-assessment tools. That means evidence-based mental health evaluations available offline, wellness resources, downloadable articles, videos, and stress management exercise for offline access, stress management support, interactive tools like breathing exercise and mindfulness activities, accessible without internet, of course, because this is very important, especially in Nigeria, where the electricity and the service net is very bad, because I'm also from Africa. So I know the challenges there in this part of the world. So the anonymous support also will feature the app, like offline peer support features and directories for nearby resources and directory, preloaded contacts for local mental health service and emergency helplines. This is very important when people are having like a suicide thought or whatever. Progress tackling, offline tool to help users monitor their mental health well-being over time. These initiatives are designed to improve mental health literacy, reduce the stigma, access the vital resources, even in areas with limited connectivity. So the steps that we will undertake is that to conduct a community assessment in identifying specific needs, develop cultural appropriate materials to educate and raise awareness, train facilitators to lead mental health programs, educate youth on accessing and using the Mind Connect app, and provide ongoing support for its effective utilization. Establish peer counseling network and support groups to foster resilience. Partner with one school, university, and community centers to engage 500 participants aged 13 to 25 years. And the intervention timeline will be 18 months with assessment at 6, 12, and 18 months respectively. The theory of change, our approach is based on the belief that increasing mental health awareness and providing resources will better equip communities to support youth well-being. This will reduce stigma, improve the mental health outcome. Key models and alignments are the health belief model, which is known as the HBM, addresses beliefs and barriers to improve accessibility. the logic model and creates a structural pathway for tracking and scalability. The WHO supports the mental health action plan from 2013 to 2030 to prioritizing stigma reduction, awareness, and youth recovery. This is also very important. So the timeline, I'm going to give a high-level overview of the timeline in 5 phases. So the project will unfold in 5 phases. The first phase will be the first month to the second month will be with like research and stakeholder engagement to build awareness and partnership. The second phase is the 3rd to 6th month, developing and launch the Mind Connect app, recruit and train mental health counselors, and begin workshops to enhance mental health literacy. The 3rd phase will be due at the 7th to 10th month, expand app usage and workshop access across institutions and communities to ensure widespread adoption. The 4th phase will be at 11th to 16th month, monitoring evaluation progress, updates the app based on feedbacks from the counselors and the community participants, and refine program components with a focus on resilience and stress management. The 5th phase is the last one. This will be at the 7th to the 18th month, disseminate results through final evaluation, data analysis, and report to inform future scaling and successful strategies. The staffing plan, as for our team, my role, Aissata D. Koroma, Program Director. I am responsible for leading the project strategy, ensuring alignment with our objectives, and overseeing coordination and achieve successful implementation. The full-time staff will be mental health professionals to deliver direct support and services. The project coordinator to manage day-to-day activities and logistics. The community outreach officer to build trust and connections with local communities. The consultants are also there, will be hired. Data analysts to develop and analyze metrics measures, our impact. Training specialists to provide capacity building workshops. This is very important. Legal advices are also to ensure compliance with Nigeria health policies and regulations because we don't want to cause any problem. So the key partners for the project to succeed, we will collaborate closely with the community organizations, mental health professionals, and educators. The technology partner will be the Andela, which will support the app development, updates, and data security for improved mental health access. And the MANI, which is mental health advocacy, they will provide advocacy content and resources for cultural relevant workshops and counseling. Faith-based outreach, Nigeria Faith Action Association. They will organize workshops in faith-based settings to promote mental health acceptance and trust. Educational institution, the Amadou Bello University and Bereva College of Zaria support recruitment, workshops, and mental health awareness. And we're gonna also have additional collaborations with the Nigeria Drug Law Enforcement. They will address substance abuse with stigma. Association of Psychiatrists also in Nigeria, the APN, ensure quality cultural sensitive mental health support. Faith leaders foster trust and participation in Kaduna communities. The budget prioritizing impact resources allocations for training, materials, evaluation, and compliance. The personnel, we have the budgets of 88.5, including program director, clinical director, monitoring and evaluation lead, director of partnership, director of marketing and communication, field coordination, mental health counselors, data analysts, and legal advisor. And the contract will have like 11,500. App development and consultants for technical support and maintenance. Supplies 9,500. Workshop materials, digital tools, and software for program implementations. The indirect costs will be like 10,500. So cover the 10% of total direct costs to support administrative expenses. So the total program cost is $120,000. Our evaluation plan focuses on measuring the program's impact on mental health awareness, stigma reduction, and service access using outcome evaluation, productivity and effort evaluation, and capacity development evaluation through surveys, app analytics. Community feedbacks, we aim to track progress and ensure long-term sustainability. Surveys tools will be surveys and app analytics to track the engagement, workshop feedback to access effectiveness and reach, focus groups and interviews with key stakeholders. The schedules will be 6 months, initially assessment of awareness and engagement, the 12 months evaluation, stigma reduction, and resources utilization. The 18th month will be comprehensive review of overall impact. We anticipate increased mental health awareness and literacy. 70% of the anticipants reports improve understanding within 3 months. Reduce mental health stigma, 10% decrease in stigma among youth through app engagement and the workshop, basically. Improve the service uptake and help-seeking behaviors, 20% increase in mental health service uptake and 50% app retention by the 18th month. Empowered communities to be stronger support networks aligned with WHO mental health objectives. To dissemination, to share our findings, we will, before the program, use social media posts, brochures, and flyers to introduce the program goals and conduct stakeholders outreach to understand policymakers and key stakeholders. During the program, share regular updates via social media, monthly newsletters, and testimonials. These were very, very crucial to highlight progress and early outcomes. After the program, we publish comprehensive reports, host community events to present results and celebrate achievements, and sustain awareness through targeted social media campaigns. In conclusion, the Clear for Young Minds project holds the potential to transform mental health outcomes for youth in Kaduna. I deeply appreciate the opportunity to present this initiative and welcome your questions and valuable feedback. Thank you for your time and consideration. I look forward to our discussion.
Very good, very good. Let us use the reaction button and give Aissata some love. Great, great, great. So we have 2 projects today that are focusing on Nigeria. One in Benue and this one in Kaduna, up north. So questions are pouring in. Of course, Aissata. The first question.
Oh boy.
Are you there? The first question says, how did you arrive at 500 participants for your program? That's the first question.
Well, it's very difficult to deal with school, college, or secondary school and university because they have also their own programs. So we are looking at 500 initially, but it can also be increased. So because it's a goal that we want to see if the app and the community workshop are successful. So we're gonna start with a very small numbers and then go along.
Good. So do you think that there will be any difference in participants who are from secondary schools compared to participants who are from universities? What is your hunch? What are you anticipating?
We are looking at the age because that's why we have an age preference within 13 to 25 years. So these are the key factors for the participants, and these are the university and the secondary school. They are pupils or students who are at this age who are studying. So it's gonna be a good one. Yes, I think.
All right. Another question. How does Kaduna compare with other cities in Nigeria or any other developing country with regards to mental health literacy and outcome? In other words, how can this project be scaled to other countries or other parts of Nigeria even?
Yeah, this project with Clear for Young Mind project can be also scaled in other communities because we're using evidence-based program interventions, and also we're going to have a comprehensive reports and scalability. So and true testimonies. So this will be also a way of documenting and also implementation elsewhere in Nigeria also. So we're gonna have like feedbacks from counselors and also participants, the app usage and all that stuff. So when we document all the comprehensive documentation, and that will be also be accessible for implementation elsewhere also in Nigeria, because Kaduna itself, they are over 10 million people. So it's well populated. And due to my findings, it's also, they have a very high misconceptions about mental health stigma due to the studies that I read. So that's why I choose Kaduna.
Good. Okay. The other question is, how will the participants get the app? Are you going to give it to them free of charge? Are you going to pay for data? You already mentioned, right? You already mentioned that electricity is a problem, access to internet, that is a problem in Kaduna. So how are these young people, 13 to 25, how are you going to make them get the app?
They're just gonna, if they have an Android telephone or maybe an iOS from Apple, they will just download it for free and also offline, so they can access it at any time. They just need to have a mobile a telephone or maybe a laptop or whatever.
What if they don't have mobile phone? That's the natural next question. Are you gonna, is your program going to provide maybe a version of a cheap phone to them that they are going to use in this program, or are you just going to require them that if they do not have phones or laptops, they wouldn't be in your program?
No, and that's why the indirect cost comes in about it. I think it's about 10,500. So that's these indirect costs will be responsible, like logistics, like this. So we're gonna bring up telephones, so use secondhand, something affordable, and then we can distribute it to the ones participating. And also maybe we have other people also who have because nowadays technology is very, very widespread. And I can imagine of a population of 230 million people that a mobile telephone is not something that is difficult to have. But we have a budget with indirect costs, so we're gonna take on that money and use this for supplies like vehicles and all this telephone and extra costs. So we'll also look into that.
Very
so
good.
We are providing the telephones also. Yes.
Very good. So the other question says, if suddenly your program were to be successful, how will the world be different in Kaduna State?
Well, the youth, they will have self-confidence, and then we have the support they need, because mental health stigma is stigma as a problem associated with mental health. It's very difficult to open. In Nigeria, discussions are not open over mental health stigma. And the youth, they will have time to seek anonymous help providers, wellness and stress management, relaxation, and also tailored cultural exercises. So that will also improve their mental health and self-esteem, resilience, and all that stuff.
Thank you. Any other questions? Any person here who wants to raise their hand to ask questions? Going 1, 2. So let's use the reaction button and give Aisata another round of applause. All right, 152, good timing for all the groups. I was very glad that you all stuck by your time allocation, did your presentations that are very clear. There was an administrative question I got here. Somebody said, if I want to invite any of the groups to present to my group, how does that work? And I did reply to the person. They just need to reach out to Brown Magnus, and then we can arrange to do that presentation. I hope all the group members will, we oblige when we invite them to come present with us on these projects. So thank you so much. First of all, I would like to thank all our guests. We know that you can be somewhere else, this is weekend, but we are so grateful that you chose to spend some of your time for this weekend with us, listening to these 3 incredible groups, who presented different aspects of public health issues, both here in the United States as well as in developing country of Nigeria. Again, if you want to learn more about Public Health 360, go to myghep.org/PH360. All right, before we call it a day, does anybody want to say anything? Aisata, can you stop sharing so that I can see your faces?
Yes.
All right, Georges is speaking today. Come on, Georges.
Yes. Overall, I would say it was a very great experience. I've learned so much from the program and also from my fellows. So I've been growing a lot. So thank you very much for this initiative.
I hope I wasn't too tough on you, Georges.
No, it's good. It's good.
All right, Debbie. Debbie, you muted.
I just want to say thank you very much for every member of the GHEP team. It's an amazing team. I joined this team to fulfill educational requirements, but I have a question. I have kept this question in mind for today. I really want to join it again on my own for personal profit. I will pay, but I want to join. I've learned so much, but I think I can learn. This time, I want to join it for me. I have learned so much. Will I be allowed? Please.
Debbie, talk to Zubi. Yes, talk to Zubi. We would like to have you here. And that shows you are tough. If you think you're gonna go through the gruesome, the yelling, the screaming, the turn on, the where are you, then that shows me you are really brave, and I know you're tough. I know you're really tough, but that's a good compliment. Thank you so much. It's been a pleasure having you in the program.
Thank you.
All right, next feedback. All right, so Brown is going to have some announcements. What will happen is generally we will take a look at the Google Classroom and see if you have any outstanding work. We will require that you complete that work. You have learned a lot over these last 3 months. The ball is now in your courts to take all what you have learned and transform the society wherever you find yourself. So whether you are continuing for grad school, whether you are fulfilling requirement, whether you are working or you're seeking other opportunities, I believe what you have learned here is sufficient to distinguish you. And so remember, you're still an affiliate of the organization. We'll take a look at your assignments. If there are any assignments that are remaining, Brown is going to prompt you so that you can complete them. And then for each of the 3 projects, you have an opportunity to summarize and share lessons learned. How did it work, right? I don't want this to be just a straightforward write-up. I want this to be a write-up sharing the difficulties in coordinating different time zones, the difficulties, in trying to juggle this with work, the difficulties, somebody is in Pakistan, the other person is in Los Angeles. How did you make all that work? Reflection. How can you reflect on working together as a group or working individually? How did that make you grow? How did you just met individuals that you never knew, but you started working with them as a group. How did that grow over the last 3 months? And then ask yourself, how would I be different, right? Because if you have your colleagues, if you spoke to at least 3 of your colleagues, they are going to ask you what is different. I believe what is going to be different is the way you perceive any service they are providing. If you are a clinician and you are providing to one person, now begin to look at the population impact. If you are just out of school looking for the next job, I hope that you have learned a lot that you are going to use to ace that job. So I'm not sure if Ellie is our latest success story, if she's comfortable to share. If she's not, that's okay. But I just want to tell you, you know where we are. Feel free to reach out. We are going to reach out to you. We're going to invite you to join programs. We're going to invite you to mentor other individuals. We're going to ask you to present, so that if we have organizations where we want to provide programs, we want to give you opportunity to continue to grow. So on that note, I want to be the first to congratulate you on your successful acquisition and completion of the GHEP's Public Health 360 Fellow. Congratulations, dear graduates. All right, Brown, are you gonna sing us out?
Unfortunately, Dr. Ndu won't be singing out, but I would like to thank everyone for making it this far. Thank you so much, for putting up with us and for the wonderful presentation. And look out for the feedback from your, when we post it on our YouTube. I think the energy is good, and I think your funders will also be happy. Thank you so much.
All right. Any other comments? Any other feedback?
Yes, I just want to say thank you to everyone, the whole faculty, for supporting us every day, every week, and like being patient with us, because everyone obviously has a lot of things going on, and you were very understanding of that. And I want to thank all of my fellows. I learned a lot from everyone, and there were obviously a lot of issues with like time management, I think was a really big thing for everyone, but everyone was making sacrifices and doing the best they could. So I'm just, in one way, I'm very happy that this has ended, because I had to take a lot of time off work. So, but they were like very supportive of this. But personally, I wasn't in a place where I felt comfortable doing that. But my colleagues, thankfully, they were very supportive of this. And it's good that while they were being supportive, everyone over here was also being supportive. And I think that plays a major role in like me being able to complete this today.
Good. All right. So we're gonna see you guys. Remember to take your one-on-one. Reach out to Dr. Nzube to schedule your one-on-ones. We talk a little bit more in the one-on-one, just to get to know the career pattern, where you're going, what you want to do. If you have not updated your LinkedIn profile, don't let me email you about that. I need to see all of you on LinkedIn. I need to see all of you. It makes a whole lot of difference. I need to see. It's very easy for you to be an authority. GHEP is posting at least 3 things every week. You can just leverage all those things and post on your own LinkedIn. Be active. LinkedIn is not a dating site. LinkedIn is a professional site. So don't be scared of being on LinkedIn. Yes, I said her.
101? What is this with 101 with Nzube? I didn't get that.
Right. So that's an opportunity where I, as the lead faculty, get to meet with you and Nzube so that we can discuss your career goals, career trajectory, if you are interviewing for jobs, get to know what has worked, what hasn't worked, and how you can leverage GHEP, suggestions on improvements on resume, opportunities, kind of a one-on-one workshop that is focused on you. And the reason is because we are all different where we are in our career stages. So just trying to see where we can infuse that in your career stages, right? I know, for example, Debbie is a nurse now, but Debbie, I'm seeing Debbie becoming a nurse manager, managing an entire institution, but she's seeing herself where she is, right? Amina is a physician, but I'm seeing Amina taking on even more role, right? George has a PMP. What does that really mean? And how can he leverage that PMP? Or even Hadashir, who is working in a laboratory, what does that mean for the next thing? What is that next thing that she could do? What are those opportunities,
So
for
that
Maria,
means
for Ellie? Yes. So you just need to email Zubi. We set up a time, and then it's
okay.
just going to be 3 of us.
Oh, okay.
Right.
And what about this block thing? Because I saw Brown posted a link here in the chat. What is
Right.
it?
So last year we introduced a follow-on project where the groups, when they finish presenting, graduate from their capstone, we ask them to summarize their experiences for the outreach and for the capstone into a write-up. And what this does is that we have that published on our blog. And in addition, when you update your LinkedIn profile, you can actually link to that as a product or as a publication. And so there are 2 benefits that individuals can get. If you are very early in your career and you don't have a publication, you have a publication that will stand as an opportunity. But more importantly, gives you an opportunity to step back and reflect on all the struggles, right? If you remember all those yelling, these slides are so bad, I don't think this is good, I think this is a bad idea, and then how you grew to what you have presented there. That's really what I like sharing, the conflicts. How did you settle the conflict? The time, how were you able to manage it? Many of you are shy in speaking. You know that I'm a big proponent of seeing you on TV, because I know that once I see you, that has a way of really helping you becoming more and more comfortable. A lot of positions you will get, if you want to freelance, you're going to be working with people remotely. And so you should feel comfortable, talking, just like you should feel comfortable being in the room with them. You should feel comfortable being on video, when you are meeting with people.
I posted two questions about this blog, but I didn't have a reply. Could you please reply to that, please?
Read one of the blogs. The link.
I did already.
You read? Okay, so what we're expecting you to do is to...
I read, but I had questions because I was a bit confused about the name, because you told us initially that the outreach project doesn't have a name, shouldn't have a name.
Right.
But I saw like a fit and fabulous thing there, so I was confused. And also they were writing as if it was a real intervention somewhere in Kenya, so I was kind of confused. So I sent a message, because when you're writing the blog, you have to know the style. So I was looking
the style
and
is
how they did it, but so I was confused. I thought this one was operational framework, but not something that actually did happen. So that's why I posted those questions, but I hadn't get any feedbacks from my questions.
I would take a look at the questions and respond.
That would be great.
The blogs are usually semi-formal tone. They are not going to be too casual, but they are not academic writing, because I want people to relate to what you have written. I want people to understand how you have worked as a group. I want people to be able to navigate, to see how you navigated, identifying a project or a topic, You know, we just let you determine what it is. But at least it has to be good English. It has to be fact-based. It has to be based on the
Exactly. That's the thing.
it
That's
has
the
to be
fact
based
base.
on the project that you worked on, right? On your experience, you know. And there are multiple revisions, right? It's not like you write it and it's accepted. For all those ones that you saw, the athletes, they went through 3 revisions because they were writing it first too formal. We wanted it to change. And then they were writing it too casual. They wanted it to change. And then some of those have to be fact-based on what you really did.
That's what I was trying to know if it did happen, the interviews, because they stated that some individuals from Kenya, like with the obesity, that they said this and they said that. So I was kind of confused. Did that actually happen?
We'll take a look. Yeah, I think they must be referring to research that they did about Kenya.
But they said it as if they were the researchers and that they conducted the interviews with the population, obesity people.
Mm-hmm.
So I was kind of confused. I was saying, okay, that's why I sent those questions, but I haven't got any feedback yet.
Right. For your outreach, it happened. You can reflect on your outreach, right? For your capstone is a proposal. What you are proposing to do in a particular region. You can share, right, the overall goal of this project, and you have all the materials and the steps you went through in arriving at that topic, and then share some of your aspirations on how you think that program will succeed or not. So it's a reflection, and no 2 reflections are ever going to be the same.
Okay, but I'm still waiting on my reply, so I can know exactly what to write with mine, with the Kaduna thing.
So even with what I have said, you still don't know what to say. You're gonna write, how did you come with the name of the project? How did you select Kaduna as a place of all places? Why? You know, what is some of the data, and how will the world be different if this project were to succeed? What do you think are some of the strengths, and what do you see as some of the things that may make this project not to succeed? And it's only you or your group that will answer those questions.
Okay. Thank you.
Yes, Amina.
Yes, I wanted to ask if there was a time frame in which to prepare this blog and share it with you.
No, it's optional. You must not write it, right? Like I said, you mustn't write it. It's optional. We thought it had some additional benefit to individuals, but you don't have to write it. So the way it works is, if you as a group want to write it, that's fine. But if every other person in the group said, I'm not writing, you can be the only author, but you cannot be the only author if the other group members want to write. So remember, it's a group project and the group is reflecting on the process. Unless you ask Maria say, look, I am done with this project. I don't want him yelling at me again. I am over. And then Ellie says the same thing. Then Amna, you write it alone, you know, or the other way, you know, Ellie will say, Maria, do you want to, Maria say, I don't want to have anything to do with this project again. And then she can write by herself. But ideally, honestly, what I want is for 3 of you to write it together. You know, the other group, for the 4 of you to write it together. I think that's the contribution you are making to the community. That's the contribution you are making to other fellows that are going to come in. You know, that's the contribution you are really, and it's something that you can look back, you know, when you reflect on it. You know, people can even call you up and say, oh, we saw this blog you wrote about your project, you know, tell me about it. You never know who that person is. You know, that person could be somebody that has, you know, a lot of money, and then that is an interview right there.
Yeah, just I wanted to make sure that I think we could work on this, but like just make sure there wasn't a deadline because
There's no deadline. There's no deadline.
Intensive 3 months, so now we need a little bit of a break.
There is no deadline. No, it's optional project. Yes. I said, oh, your daughter is joining us, right? Oh, so cool. All right, guys.
Yeah. Say hi, Jesus. Say hi. Hello.
Hello. All right. So we're gonna see Ellie. Did you want to share anything? No. Okay. Ellie doesn't want to share. Okay. But please remain in touch. We're gonna add you to our mailing list. Please do not unsubscribe, right? We are planning next year to hold Brown, are we still recording? Can we stop the recording now? Thank you. So